couple minutes until we reach something close to quorum. Of course, people will filter in throughout the time. But as you join, please feel free to turn your camera on. If you're new or if you feel like introducing yourself, please feel free to do so in the chat. We would love to hear from you. And we will get started in just a couple of minutes. So again, thanks for being here with us today. We have a kitty cameo, which is always lovely. One of my personal favorite kinds of cameos. Well, folks are filtering in. We have a good number. So I am going to go ahead and kick us off with some introductions just before we dive on into what brings us all here today, which is some good old research. So very excited to share that with you. Before we do, for those I have not had the pleasure of meeting just yet, I'll take a moment to introduce myself, who I am, why I'm speaking with you today. But my name is Alex Duke. I'm the Associate Director of Research here on Nursing Catalyst, and I led the research that we will be discussing today. So a little bit of background on me. I have spent just about the entirety of my career doing global market research, which we're coming up on a decade, which feels quite crazy to say. But my focus there really has always been in healthcare, helping major associations, health systems, industry companies drive policy and advance the causes that they care about through research, which is always really exciting. So really doing that by understanding what resonates with their stakeholders, their groups of interest. But really what my work is and always has been all about is identifying what wins friends and influences people, and how can different organizations leverage those findings to really drive their causes forward, which is always really exciting. So today I'll be sharing some insights from our recent research, discussing how these findings can help us move strategically as a group towards our goals. And that research is, of course, all about how does your frontline feel about safe staffing, and various technologies that kind of support safe staffing. So things like AI, virtual nursing, and how can you as leaders better communicate with them in a way that engenders curiosity, if not downright enthusiasm, fingers crossed, and really get them on board and excited about these new technologies. So taking a moment, in case you have not been with us before, in case maybe this is your first Nursing Catalyst meeting, really excited to have you here with us today, but we'll take a moment to just introduce you to Nursing Catalyst. Assuming all of you have heard about us at least a little bit before in some capacity, but maybe for those who need a refresher or who are coming from the lab side as a mentor, which is always really exciting, just want to give you a quick level set on who and what Nursing Catalyst actually is, and more specifically, what we do on the research side of things. So at a really high level, Nursing Catalyst is an innovation incubator. It's really meant to improve how do we push care model redesign, and specifically support roles that can lead this change in a bi-directional manner. So both from the top down, as well as the bottom up. So the work that we do here is all about really pushing innovation forward. It's going to be a big theme of our conversation today. And we are divided into two areas to do just that. So again, most of you are familiar with the cross-system idea labs, but the second half of our program, which you are engaging with today, whether you know it or not, serves nursing leaders like yourselves. So that is our research-backed innovation collaborative. We pick a handful of focus areas, typically 3 to 4 a year, and we design dialogue to really help you push forward on strategy there, and advance your decision making. So really excited to share some of that with you today. I'm going to walk you through a little bit about the research that we are going to talk about today. Some of you may have been with us back in, I want to say it was September, but this is actually a part 2 of research that we debuted back then. So some of you, again, may have seen part 1, but to just quickly recap on where we landed there. We conducted a national survey of frontline bedside nurses, which includes a message testing component, which I will orient you to in just a moment, to really understand the perspectives on safe staffing strategies and safe staffing at large from your front lines. So we really wanted to gauge sentiment there, knowing that how nurses feel about staffing can really directly influence influence broader policy, operational decisions from legislation to innovations like AI and virtual nursing. So our goal there was really to explore where do these beliefs that frontline nurses have come from, what motivates them, where are they getting their information, insights that can help orgs like yours and leaders like yourselves really engage with them more effectively. So in our time today, what we're going to be unpacking is that message testing component that I mentioned. But what I want us to keep in mind from part one, we have 4 key assumptions that you can see on the screen. So from our findings, we learned that frontline nurses have really low confidence in their organization's ability to ensure safe staffing. So I believe the number was only 7% expressed a really positive sentiment there. What we found, kind of finding number 2, is that this is driven by a lack of information rather than real direct disagreement or dissatisfaction with your system strategies. I think the number there was over half or close to 60% of nurses reported feeling uninformed about their organization staffing plans, which we will dive into a whole lot more there. Number 3, some good news to share back with you, which we'll be unpacking today. Our message testing revealed that it's actually really possible to change minds here. So we can, when we present folks with structural realities and kind of system constraints, we saw sentiment shifts of roughly 20 to 25% in a more positive direction, which is, if you are familiar with message testing like I am, a really significant shift actually. So that was folks jumping from saying, hey, I really don't like AI, I really don't like virtual nursing. 20 to 25% of those folks actually shifted to a more positive frame of mind there, which is really exciting. And again, today we'll talk a little bit about how you can all inflect that change. And then last but not least, where do they get their information from? Where do they want to get information from? So nurses prioritize information from leaders like yourselves and professional associations over social media, which I feel like is really important to call out, which highlights a real key avenue for engagement, which we will talk about a little bit more today as well. Moving us on, what is message testing? You've heard me mention it a couple of times. Some of you may or may not be familiar, but this was the major focus of our research. So in addition to getting that level set of where are the hearts and heads of the front line at, which we just took you through, what they believe, what do they want to see more of or less of, we also wanted to get a feel for how movable are these beliefs that they hold around things that are directly related to your strategic priorities, like AI and virtual nursing. So to do this, we conducted what is called a message testing exercise, which is very standard in advertising or politics, where the goal is, as you are familiar with, to really sway perceptions or opinions or feelings in one way or another. What we ended up doing was asking frontline RNs for their perspective on various strategies, including ratios, but also, again, virtual nursing, AI, team-based care, and really just those various levers you can pull to make staffing safer. We then exposed them to messages around things like nursing supply, nursing shortages, impact to patient care quality, workload, and more. So really the facts and things that you all have visibility into on the day-to-day, but maybe that your frontline doesn't get so much exposure to. And then we asked them again, those same questions. You know, we've just showed you some information. Now, can you tell us how you feel about safe staffing, about virtual nursing, about AI? And again, we saw some really positive jumps there, which we'll be unpacking today. What is on today's agenda? So in the next few minutes, we're going to discuss some of the major insights from the data to really get a baseline understanding of what are the most effective, most resonant messages that frontline nurses really take to. We'll look at, what they took to through focus groups, through surveys and other discussions, and really unpack that why behind these messages. How can we really refine our communications approaches? Additionally, we've also developed a few ideas for our opportunities and how to move this work forward and really inflect that change within your own organization. So we'll unpack some of that as well. And then we will end on some things that we think will be helpful for you in taking this work forward and trying to get your input there should we have time. So moving us along, again, the goal of this section is just to really download you on what we found and what it is that your frontline cares about when it comes to communications and also just innovation at large. So again, really focusing here on what resonates, what doesn't, and why is that the case. So taking a moment to level set on the data that we found at large, really just regrounding us in the data. We talked a bit about a few assumptions that we can make about your frontline workforce. But this is the real challenge that we want to discuss and address today. So there's, a lot going on with associations. There's a real clear opportunity to close the communication gap, as I've mentioned. But the real fundamental issue that exists at the core of all of this is that your staff's vision for nursing's future is really out of whack with what leaders like yourselves are driving, and also, of course, what's being introduced by associations like AONL. So for your frontline, it's really about getting bodies on the floor, really hiring more staff, and it also, of course, comes down to ratios, which is really, again, wildly different than the innovative, really tech-oriented futures that many of us in this room not only envision and hope for, but are really actively driving towards and investing in. This is a huge problem because, as you know, your frontline are the ones that actually are tasked with working within these new models that are being introduced. And at minimum, our hope is that they are bought in, and ideally, in a perfect world, that they're champions of these changing models of care. So if you're going to enact your vision of nursing's future, you really need to start now, again, by engendering that curiosity, engendering ideally enthusiasm for these tech-enabled solutions that we'll talk about today. We'll also be talking about really good communications principles for all of those different changes that you're working on and looking to drive towards. We'll take a moment to let you know a little bit about what it is that we actually tested within this message testing exercise. So, as we mentioned earlier, our goal with this research was to look at different messaging strategies to understand which ones are most effective in engaging frontline nurses. So our goal with these specific messages was to replicate the kinds of information and informational context that you live and breathe every day in your roles, the kinds of conversations that we have in this room that make you excited for care delivery innovation. But what we want to understand of that context when it comes to frontline nurses, what is it that is most effective in communicating to them given their roles and priorities? So to do that, we boiled it down to 4 key messaging themes, which I'll take you through these at a high level. And then, of course, you will get these slides and follow up, and you can see kind of the full download of what it is that we actually tested. First one being on nursing supply, right? So really highlighting the broader workforce challenges such as the national nursing shortage, projections for future workforce gaps, and really just those larger market trends that are at play. Second, workload, addressing day-to-day realities like burnout, job dissatisfaction, and engagement, really acknowledging the really tangible pressure that nurses feel in their roles on the day-to-day. Third, impact of nursing supply on patient quality. So really tying those staffing challenges directly back to patient care outcomes. In particular, how do shortages affect patient access and quality, which of course directly aligns with nurses' top priority. And then last but not least, health system financial stability. So really sharing insights with them into how do staffing costs impact hospital operations, closures, long-term sustainability, and kind of bringing in that more systemic perspective that nurses may not often be hearing. We didn't just test the content of these messages, but also, again, their impact. So specifically, of these messages that you are seeing on these screen, the kind of 4 high-level categories that we see here, what creates a sense of alignment, engagement, and confidence among your frontline nurses. So with that high-level introduction, we'll take a moment to walk you through how these were received and how they performed with frontline RNs across the country. As we dive into the message testing data of it all, one of the first things that stood out to us was that your staff actually really highly trust the information that we share that with them, which is great news. We weren't hearing a ton of skepticism around, I don't know about this data. What they're lacking isn't trust. It is familiarity, which is what our data found. They're simply not getting the information that they need to feel confident. But there is good news here, which is that once they do get that information in hand, you as leaders actually don't need to expend a lot of effort to get them on board. There's not a lot of convincing that needs to be done. They really just need information in hand, and they kind of go from there and move more positively as a result. So again, our goal here was to really translate the conversations that you're having in the C-suite into messaging that resonates with the front line. So for example, you might be discussing how workforce challenges limit your ability to implement things like ratios, but your staff aren't often getting that context. So again, just to really drive home the point, the low confidence that we mentioned earlier, it's not necessarily about outright disagreement or outright skepticism. It's primarily a lack of information. One thing I want to flag before we move on, that 32%, that pink bar that you see on the left-hand side, that might seem a little low at first glance, right? Only 32% trust these. But keep in mind that this is an average across those four data sets that we saw. When we look at the most compelling data sets and messages, which we'll explore in a moment, trust is actually really significantly higher. So again, this is an average. But in general, we consistently see trust in data exceeding familiarity across the board. Getting into what it is that actually resonates with Frontline RNs, right? We've teed it up, you've seen the messages, what worked. As we dive into that data in general, the most resonant messages sets are really all about workload and patient quality and access. I think on a personal note, this kind of surprised myself as we initially really expected those market trends, that nursing supply data, to resonate a bit more strongly, just given how much airtime it gets in industry conversations in the news. I think we've all seen the snippets, but what I think this reveals is a really important insight. And that is that your frontline staff, they're prioritizing what they see and feel in their day-to-day work, what it is that they're feeling in the day-to-day on their units. And these message sets that resonated, this talk about workload, this talk about their patients that they're seeing daily, this connects them with what is, most immediate and most tangible. I think this reinforces the idea that to really truly engage your staff, messaging needs to meet them where they're at and really speak to the direct challenges that they're feeling on a daily basis. It also speaks to what they want from you as leaders in this room and to where there might be a bit of a potential disconnect. Many RNs we spoke to and surveyed as part of this work expressed that they felt there's a real fundamental misunderstanding between themselves and their nursing leadership bench, namely that they don't feel like you all know what is actually occurring on a daily basis on their units as it relates to those things that they care about. So workload, patients, staffing. For them, at a high level, feeling understood goes a really long way as it relates to their confidence in what you are all driving, in what you're investing in the organizational initiatives that are at play. And it really affects their acceptance of new technologies and rollouts on their unit. I'm going to go ahead and unpack this in a little bit more detail. So again, when it comes to messaging, the most influential approach that you can take is the one that validates Frontline RN's realities. So really specifically messaging around workload. What we see here is a significant gap, again, between familiarity and trust. 42% are familiar with some of the data that we tested in this fact set. 71%, however, trust that information once they receive it. I think this makes a really powerful point that when you validate and contextualize workload at this level, you're not only speaking to the individual needs of frontline RNs, but you're also providing context about why these challenges on the unit are happening and that the initiatives that you are rolling out are intended to address them. I think there's one quote that you can see up in the top right corner from a frontline RN that captures it really well. They want to feel understood by you. I would like for my CNE or even my CNO to summarize for me what it is that's going on, to explain that you kind of understand these things, and you do. This speaks to a core issue. I think that frontline staff often feel unseen, unheard by leadership. Many RNs are believing that, their leaders don't fully grasp those day-to-day realities. But when leadership communicates with transparency and with context, acknowledging not only the workload, but also the broader constraints and strategic challenges, your frontline responds with really high levels of trust and buy-in, which is exciting. Ultimately, this messaging around workload really works and resonates because it bridges that gap between recognizing burnout, which we all know is a significant issue, and offering a clear rationale for why things are the way that they are. It's not just about sharing data, it's about sharing, again, that understanding, demonstrating that leadership is not only aware of the challenges, but also actively working, engaged in, and investing in things to address them. Another thing that the frontline is really moved by, we talked about workload messaging as most influential, but this message set that really focuses on patient care quality, patient care access is similarly compelling to your frontline, but for different reasons. So what's surprising here is that many frontline RNs don't fully understand how strategies like mandated nurse to patient ratios can actually negatively impact patient care quality when we look at the data. The familiarity metric here is pretty low. We see 24%, but when they see it, again, 57% say they trust that, which is really exciting. So again, this highlights a key opportunity when we share insights into how staffing, into how ratios and new technologies impact patient outcomes. It resonates really deeply. And I think that's because it ties back to that core mission and the core values of your frontline, which is that, they really care about their patients and they really care about how these new initiatives are going to impact them in their day-to-day and their ability to provide that high quality care. For your frontline, again, not always about workload or operational changes. It's about maintaining a really clear line of sight to their purpose. Again, going back to providing safe, compassionate, effective, high quality care. And when messaging, when communications from you all, connect these changes directly to patient impact, it shows that you are all aligned and it really bridges that gap between reality, the frontline reality and also leadership strategy. So this alignment not only increases trust, but it also builds buy-in as nurses see kind of that why, that underlying layer behind the decisions that are being made. We've talked a bit about what works. What is it that resonates amongst your front lines? I'm going to take a moment to talk about what doesn't. So we'll talk a little bit about messaging around nursing supply. Financial sustainability doesn't resonate as strongly with frontline RNs. Starting with financial sustainability, I think this one isn't so surprising probably to folks in the room that your frontline isn't particularly moved by messaging about the bottom line. It's just not what they're focused on, as we saw in the previous data when discussing health system finances. Much more effective to frame it within the context of patient care. Specifically, doing things like reassuring your staff that financial strategies will not harm their ability to provide that quality care, but talking about ROI or the bottom line or money saved within an initiative doesn't totally land as well. Second, when we talk about nursing supply, the story is a little bit different there. Your frontline is a little bit less compelled by supply messaging because they don't see it as something within their control or even necessarily your control. They're just not super concerned with broader market supply trends. They care again about what is it that they are directly experiencing in their day-to-day work. They're focused on staffing levels within their own units, how that impacts their workload, and ultimately how it affects patient care. I'm going to take a moment to pause here because I'd love to hear from all of you. How does this track with the conversations that you're having with your staff when it comes to these topics? Are you noticing similar dynamics? Have your experiences been different? Would love to hear from a few folks.
This is Deb from Hopkins. What you're saying about having a direct conversation with them around a clear plan, even though not all the lines are filled in for them, but just to be reasonable and honest with them to say this is our plan, where you're talking about recruitment or retention or market adjustments or whatever it is. I always find that nurses do really well if you and they hang with you if you are clear communicator with the plan at where you are, honestly, where you are with it, and then circle back to check in with them. If you said this should happen in a couple of months, and you really are coming back and saying, did it happen or why didn't it happen? I think nurses resonate with planning, right? And knowing and saying really what are the challenges and sharing those challenges with them. Not in a way, and I'm always very careful not to say this isn't affordable or this isn't real. We don't have the money to do this, because I think they think, well, what is the value proposition here with me, right? So I'm careful not to do that, but I think you can communicate there are limited resources, right? They're limited and they have to be, the other thing nurses listen to too is if you're talking about the whole care team and how those resources have to be spread across numbers of people because they often are advocates for the support staff. That's just my experience.
Absolutely. Thank you for sharing that, Deb. You make some great points. One that I want to touch on specifically is that, this isn't a guide of what necessarily not to touch on or to lead with. Your nurses still want to know what's going on with health system finances, things like that. But it's more about what do you lead with to get folks on board? And then what is more of kind of a foundational data point, maybe, or something that comes a bit later. So thank you for sharing that. Anyone else? Was any of this surprising, maybe? Well, I will keep us moving along. A really exciting part of this research, again, is that message testing component. So we told you what resonates, what performs, what maybe doesn't. But what we also established here is how do those different messages actually move the needle? What kind of change is inflected when we look at the data of how they felt about solutions like virtual nursing and AI before seeing messaging, and then how did that change after being exposed to message testing? And what we found is really interesting, which is that while minds do change on care innovation when it comes to being exposed to those messages, not everyone shifts equally. So again, we looked at this by measuring how much frontline RN views changed before and after seeing the messaging and data that we presented them, and then parsing those folks out into groups based on the trends that we saw. And what this gave us is a really great framework for how people move and what it is that they're moved by. And where we landed was three distinct, I'll call them personas, of skeptics. So these are your least trusting, kind of most resistant faction within the frontline workforce. Your champions, so the most positive and likely to kind of spread that good word around these innovations. And then last but certainly not least, your swayables. So those who were most open to changing their minds, which I think is really exciting. Functionally, what these personas mean is that skeptics, all the way there on the left-hand side, started with a negative belief around virtual nursing and AI, and even after messaging, they remained entrenched in those beliefs. They remained negative after seeing it. So then we get into swayables who began negative or neutral. They said, virtual nursing and AI, not necessarily for me. But after being exposed to messaging and data, again, that we've covered today, they jumped into the positive category. They said, I actually think I'm on board with these technologies now knowing what I know, which is really exciting and a real clear area of opportunity for all of the folks on the line today. And then champions started positive, were on board with AI and virtual nursing before. And then where they ended was they were still positive, if not maybe a little bit more so. But again, some real opportunity here with those folks as well. This breakdown reflects the broader workforce at play, reinforcing a theme from our September discussion for folks who are on the line then. Most of your staff actually fall into the swayable category. So there's a ton of opportunity to inflect change here, which is great news. Additionally, at least roughly a quarter of your staff, of the folks who took the survey of Frontline RNs, are champions. They're already enthusiastic about innovation, and they're kind of willing to go forth and do peer testimonials and really talk to their peers about why this technology has worked for them and the positives that they've seen from it. I do want to take a moment to double click on what this means for different kinds of innovations, right? We're talking about two key technologies, virtual nursing and AI. These personas that we're talking about, so skeptics, swayables, champions, they do not stay fixed across different innovations. So just because someone is open to one technology like virtual nursing doesn't necessarily mean that they're also a strong supporter of AI. And on this slide, you can see that breakdown of these personas across virtual nursing and AI. So a lot more skeptics for AI, but a lot more swayables for virtual nursing. And really the point to drive home here is that what you can see is the same individual might be a swayable for one innovation, but a skeptic for another. Why is that relevant to all of you? It's because this really reinforces the need for a deliberate and tailored change management approach for each technology that you're bringing onto the unit. It's not enough to assume that buy-in for AI automatically translates to buy-in for virtual nursing. Each requires its own targeted messaging engagement strategy and proof points to build confidence to drive adoption. Another thing to call out here, when we looked into these personas, we looked into things like age, tenure, unit types, union status as well, the usual demographics. And we found no strong relationship between demographics and where individuals fell within this framework, which I think was a learning lesson for me and my team. I think I came in with some expectations here around who would fall into what bucket. And it was a great learning lesson in that we really can't assume who is a champion versus a skeptic just by looking at, oh, this is a new nurse versus maybe someone who falls into the veteran category. We'll take a moment to double click into each of these personas that we've crafted. Skeptics, who you are all likely familiar with as they're some of those louder voices that you hear within your workforce, are the most resistant to care innovation. So these are the folks that prioritize those human-centered nursing strategies above all over text-based solutions. Again, these are the factions of folks that remain really staunchly entrenched in their negative beliefs on AI and virtual nursing. Messaging and data just does not move the needle. A key call out here, which you can see on the bottom right corner, this is also our least informed group. So 69% say they do not feel informed about organizational staffing strategies, which is a really big number. As we look at this group, can sound a little bit discouraging, but I do think that there's opportunity here. The goal isn't necessarily to win these folks over. Don't know that that's totally possible, at least not in the immediate, but it's really to minimize opposition and also to minimize the number of skeptics that you're creating, which we'll talk about in just a little bit. On the opposite end of the spectrum, we'll talk to you a little bit about your champions. These are your allies in pretty much any innovation effort. They are natural advocates who already see the potential of these new care models and technologies. They feel positively towards innovations like virtual nursing and AI before messaging. They remain positive after. And importantly, they don't view implementation challenges as barriers, but rather as problems to solve to get to a really good place on their units. Our research shows that while champions are really highly engaged, again, they are on board, they feel really positively about these technologies, they're also highly data-driven. So even though they are pro-innovation, pro-AI, pro-virtual nursing, they do still have concerns and should definitely not be overlooked when it comes to change management. So to get these folks fully on board and to kind of continue leveraging the power that exists within this group, we really need to bring it down to the numbers. So publishing pilot testing results, sharing KPIs tracked, and then how those KPIs end up turning out after a few months, and really just what the measurable impact is so that they can continue spreading that good word. They also need really clear reassurance that any new initiative will not compromise patient care quality or increase workload. Last but not least, we'll talk a little bit about swayables. So this is your biggest opportunity for cultural and operational transformation. So these are the folks, again, who start from a place of skepticism or neutrality, but are highly responsive to data, to real world examples, and to strong leadership communication. So unlike skeptics who remain resistant even after messaging, swayables can be moved really significantly. And in many cases, they already want to believe that innovation can work. They just need proof. They just need data and information in hands. And from there, they're good to go, which is great news. So from a leadership perspective, this means that your swayables should really be your primary targets for engagement efforts. They need exposure to peer experiences, to outcomes, and direct communication from leaders. I think the data here is critical. So post-message testing, these are the folks who had the biggest jumps. So we saw a 40% increase in virtual nursing support and a 65% increase for AI support, which again, really significant numbers there. And just want to reinforce here, a lot of opportunity in this area. We'll talk in a moment about how do you actually inflect that opportunity? What are the steps that you take to get there? But I think what this reinforces is that with the right approach, your swayables can be activated as adopters. You can minimize the skeptics that you're creating, and you can potentially create even future champions who will go forth and kind of do the footwork for you within their units, which is really exciting. Any questions about this framework that we've set forth?
Hey, Alex.
Okay.
First off, great information. The component around sort of the literacy gap that's leading to skepticism is one that I think there's a unique opportunity for us to deep dive into. These types of technology are not uncommon to other industries, and for whatever reason, they've been able to excel at a much faster pace and scaling up their ability for their team members to. And I think about we were just doing some work in a food bank plant here recently, and much of it was led in terms of their workers in the warehouse using AI, digital technology and other things to really enhance the workflow. And they've been able to explain it in a way that as we connected with some of those workers, they talked about it's increased their ability to be more efficient. And so we talk a lot about, this in the context of, I think the skepticism come, is this going to replace me? And it's more, how do we translate the dialogue to, this is going to elevate your practice and create some literacy around that so that people understand the impact of that. And I don't know, it seems like that's a space that we could really lean into in order to circumvent some of the skepticism that I know we're even receiving. We're a union organization, so this is like the number one thing that the unions are touting, is that if you advance these technologies in your organizations, your jobs will be replaced. And we know that that's not necessarily true.
That's a great add, Trey. Thank you so much for sharing that. I think you make a great point that we're going to touch on in a little bit, which is that there's real opportunity to dispel some myths around AI and virtual nursing, right? There's some misinformation out there that's causing a lot of fear within your front lines. And even in the survey data that we have, we heard folks saying virtual nursing is death. AI is going to kill my patients, which is really scary. Those are really fear-driven statements, and they also show a lot of misinformation, which again, there's this appetite for information that we're seeing, which makes it really easy to close the gap, I think, once the kind of foundations of education and information sharing are there. So I think there's real opportunity there. Another thing that we see that you touched on is this interest in real world case examples. And we don't dive too deep on that, so this is me kind of waxing on a bit, but I think there's even opportunity to share case studies from other industries in terms of their successes, in terms of, those folks who are maybe in the quote unquote front lines of the warehouse. How is AI impacting their jobs? And just showing that this is happening across industries and it's not resulting in that job loss. It's actually resulting in people feeling a lot happier in their day to day, which can absolutely apply to nursing as well. So great points. Anyone else? Any questions or thoughts about this framework that we've set forth? Right. Well, I am going to keep us moving into our next section, our part 2 of our discussion today. So we've talked a little bit about these 3 different personas that exist within your workforce and within your frontline RNs, who they are, what resonates, what doesn't resonate, and then how those messages also can shape frontline RN sentiment. So now I want to take a moment in the time that we have remaining to talk about how you actually create that change and what steps you can actually take to do so. So how are we moving our swayables from that place of skepticism to a more positive stance? How are you minimizing resistance from your skeptics? Really, how do you go forth and build your communication such that you are inflecting change and getting folks on board? So that's where we're headed next. We'll break down a few factors, but before we do, want to take a moment to orient you to 2 goals for the guidance that we're about to discuss. So at the core of this, we see 2 key levers to getting your frontline RNs on board with organizational change and innovation. The first being to stop creating skeptics, which easy enough, right? Probably much easier said than done. One of the biggest drivers of skepticism isn't that resistance to change. It's not that I just really, firmly believe this and I'm going to stick with that because I want to. It's more about that lack of information is what it comes down to. So nurses who don't feel connected to their organization's strategy and priorities are much more likely to disengage or resist innovation or new things that are brought onto the unit more generally. The first step, as we see it here, is making sure that your staff feel generally informed about where your organization is headed, how leadership thinks about workforce challenges and the like. And we'll talk about more about that in the next 20 minutes or so that we have. The second step, as we see it, is really key in taking advantage of that opportunity that exists and shifting your swayables to champions. So again, to reiterate, your swayables are that more persuadable group, but only like skeptics, when they have the right information in hand. So this means providing really clear, structured education on how these new technologies work, on how they impact patient care, and what they mean for nursing practice at large. The more confident nurses feel in understanding why changes are happening, how they fit into their daily work and their daily workflows, the more likely they are to move from a place of neutrality or skepticism to being active champions and actively on board with the changes that you're driving and investing in. I think if there's one clear takeaway from our conversation today and from the data that we've looked at, it's that information is the key to shifting minds within your workforce. It reduces skepticism, it persuades your swayables, it empowers your champions, again, to go forth and do that footwork. But right now, most nurses feel like they don't have enough in their back pocket, and the data shows that. You can see that big 96 on the left-hand slide. 96% of registered nurses want more information, and they want to feel more confident in the strategies that are at play. So again, real appetite here for more information, even amongst your skeptics, less so than other groups, but they're still saying, I'll take it. I'm curious, and I want to know what's going on. This comes down to a couple key areas of communication. So first, there's that organizational level. So nurses need to feel connected to system priorities. They want to understand how leaders are approaching workforce challenges beyond just new technology. They really want to understand how you're thinking about safe staffing and staffing at large, about career growth, about investments in workforce solutions. And what that also means, to Dre's earlier point, is providing concrete examples of how innovation will support nurses and not replace them. So how are you making their day-to-day easier by implementing this technology? And what does that mean for job security? Second, there's also a really big need for technology-specific education and information. So a lot of frontline nurses don't necessarily just need reassurance around, this doesn't mean jobs are going away. This doesn't mean that we are laying folks off. It also comes down to a need for baseline education on what these new technologies actually do and actually are. So this means explaining how artificial intelligence, how virtual nursing and other innovations work, providing specific use cases that can connect technology to real nursing workflows, and clarifying override protocols, patient safety measures, et cetera. So without this level of familiarity, even the most well-intended initiative will likely struggle to gain traction. I think last but not least, and we talked a little bit about this earlier in terms of, should you be sharing things about market trends, nursing supply, about health system financial stability? And the answer is yes, just maybe kind of in the aftermath and not as kind of a key point to stake things on. So your frontline nurses, they do want and desire this context on broader market trends. They do want to understand how national nursing shortages, how burnout rates, how broader staffing challenges are shaping the need for new care models that you all are seeing. Again, it's just not the thing to lead with. When frontline teams see that bigger picture, they're kind of more likely to connect the dots between what's going on and what innovations are being introduced and invested in. And we see this connection as the key to driving really sustainable change. Moving us on, I want to take a moment to discuss and hear from the room. What barriers do you feel you face to keeping your frontline workforce well informed? What makes it hard?
Well, the way that we communicate, right? I had a nurse on rounds the other day tell me, it's pretty funny. She says, I read email. And she knew she was an outlier. I was running with a group, a group of nurses on night shift. And she says, yeah, I read all the email. And her colleagues were like looking at her oddly. And she says, yeah, I kind of stick out that way. Because people don't read email. And so how are we supposed to convey a lot of information and keep people posted? I mean, we try to do as much in person, but when you have large hospitals, you're just not going to be able to do all that in person. It's good to do it because people know that you're doing it, and just knowing that you're meeting with them is good. They talk about it, but in terms of content, I struggle with that. And we do, TikToks sometime or just short videos. But it's even at a town hall, you're only gonna get a tenth of the nurses that you need to communicate with. So that's a challenge.
Absolutely. Thank you for sharing that, Deb. And we're going to talk a little bit later about how you combat that. But I think you make great points. And one of my favorite takeaways from our research last year was that folks are not reading their emails, which probably is not surprising, again, to folks on the line, but was an interesting one for us. James, I see you have your hand raised. You're muted.
I thought I unmuted. I echo everything that Deb says. It really boils down to time and nurses having the time, and you have to be very considerate of, pulling them off for a meeting. How many other meetings were they pulled off for? When you think about how they're thinking about ratios, every time you pull somebody out for a meeting, the other nurses' ratios go up. If you're looking at it that way, everybody's covering, and all of the different, policy changes, new equipment, everything that we have to pull nurses away for, unless they're doing it on, additional time. So the biggest barrier is finding that time, and you do just need an omni-channel approach to that. And, some will get it through email, some will get it through meetings, some will get it through social media, different ways.
Love that. Omni-channel approach is definitely the name of the game, and we will be discussing that very shortly. So thank you for introducing that. Tammy, I see you also have your hand up.
Thank you. I agree, obviously, with everything that my colleagues have said. I'm standing there thinking I just left a group of about 150 nurses in our residency program. And I'm thinking that our future really relies on getting in front of our new people as they come in the health system early on, and incorporating some of this technology into the workflow. For instance, I'm still struggling with getting them to use their Rover devices. And, we think about how much more efficient it can be. And so when you get in front of them and explain the why, like you're saying, and I just feel like we are missing the opportunity to incorporate these technologies into what they're currently experiencing in their day-to-day workflow from the very beginning. Because if we teach them the way that our current staff are doing things, then we're just fighting an uphill battle. So I guess my answer is we really need to get super champions with all of our new people. And because if we didn't change the way we did documentation and take away the paper, we'd still have people charting on paper, on computers, and this and that. And so I think we have to take away some of the options, unfortunately, and really push the technology in a positive way and get our newest people as our champions. Just thank you.
Yeah, that's a great point, Tammy. Thank you. I think it really does come down to how do you make technology the norm? How do you make using these technologies the norm and something that kind of goes without saying rather than something that feels really new and scary? So thank you for sharing that. Anne Marie, I see you have your hand up as well.
Hey, yeah, I'm going to agree with Jim Ballinkoff. Don't pass out, Jim, because sometimes we don't always agree, but I do love him dearly. Anyway, I think in corporate worlds and in other worlds, and even in our worlds, we build in time to meet, to grow, to develop. We don't build that time in for the staff. So to Jim's point, we're taking them off the unit. They're going to higher ratios. So how do you make it a norm that maybe people come in during their work time and we take an hour out of their day and they're covered and I think we just have to break that glass ceiling and make a whole new set of norms for what we're expecting of our staff nurses, because I think it's really important for them to understand the information, and it's really important for us as leaders to understand their perspective so that it can inform our decisions. I don't have the silver bullet about how to do it, but I think, if we put our heads together, we're pretty smart. We can figure it out.
Yeah, I believe in this group. And thank you for sharing that, Anne Marie. I think that's a great point. I'm really liking this conversation around norms. I think that's really important. How do you make it not scary, but the norm and something that folks get comfortable with very quickly? Not necessarily because they have to, but maybe kind of, and also because they want to, and because their peers are doing it already. So thank you for sharing that. Going to move us along in our last 10 minutes, and kind of go action by action. We've carved out 4 actions here, which we're going to discuss. Kind of to take in terms of getting folks on board, reducing your skeptics, swaying your swayables. Before anything else, education is really where you want to hit hard. By definition, your skeptics are not changeable as much as you want to get them on board. They're not necessarily movable. But that being said, what we saw in the data is that skeptics are created. They are not kind of born. They emerge when trust is lost, often because they're not being communicated to. And when it comes to new technologies, your staff can't really trust what they don't understand, or what they have maybe ingrained misinformation around, such as some of the myths that we see here on the left-hand side of the slide, like hospitals will use AI and virtual nursing to increase ratios. Virtual nursing is a danger to patients. Again, we saw some really, fear-driven comments in our survey around this is going to result in death. And then also myths like AI will run rampant and make decisions for nurses, kind of take away that decision-making autonomy, et cetera. So in the spirit of not creating more skeptics, the key here is to close those gaps in communication. And what this starts with is education. So making sure that when you are ready to roll out something new, your staff is already informed, empowered, and prepared to engage with it. So this looks like teaching them about the technology that you're rolling out before making them work with it, creating that really solid foundation. So maybe this can be things like offering CE credit modules around AI, around technology literacy, really asking the question of where are you getting people exposure before they have to change their workflows right away. And through that early education, you naturally already build a level of trust so that when you do introduce a new initiative down the line, maybe they're not thrilled, things are changing. That is hard for folks to deal with, but they're willing to bet with you because they understand how it works and why it's happening, and they feel empowered to use it. Talking a little bit about how to think about your communications and messaging around these topics, and where does all of that kind of thematic data that we talked about earlier fit in. Step 2, as we see it, is all about how you frame your messaging. You can think of it like a messaging house, which is very cute, but also very standard in market research in terms of how do we craft the most compelling, the most data-driven message possible. This is on the left-hand side of the slide. The roof is your value proposition, the big picture of why this change is happening. Sometimes when we over-rotate on that roof or that value proposition, it doesn't necessarily land the way that you're expecting. And this is frustrating, but what it comes down to is kind of that lower half of the house. It means that the foundation isn't strong, so the roof can't hold. The foundation of this messaging house is really strong data. So real world data, outcomes, and evidence, really grounding what you're rolling out and communicating in cold, hard data. This is the appetite that your frontline RNs have. This is what they want to see. We also need pillars, which are the colorful boxes that you see in that house. And these are core messages that reinforce and stabilize your communications. And what those pillars should really be built around is what your frontline RNs are telling you that they care about most, which is their workload, their patients, and also just that they feel an understanding of how technology and staffing intermix at large. What we've heard and found, again, in our research is a lot of fear around these things. And we found that if you aren't clarifying upfront what is going on, your frontline is going to assume the worst. They are going to assume that AI will result in loss of license. They are going to assume really the absolute worst. And when that happens, your swayables turn to skeptics. So to prevent this, lead with, again, these pillars that you see. So impact on workload. How does what you are rolling out actually make a nurse's job easier? Impact on the unit and staffing. So how does this change the way a nursing team functions? How, if at all, will it change the way a unit is staffed or what ratios they have? And then impact on patients. So how does this ensure better, safer outcomes? If you can get these pillars right, again, reinforced with that data, the real world case studies, you make it a lot easier for your frontline to trust in the change rather than resist it. And on the right side, we have some example talking points that support what we're talking about in terms of pillars, in terms of value proposition. We will share this in follow-up, so you'll have access to it, but also in coming weeks, we'll be sharing some more developed communications tools and lengthier talking points for leaders like yourselves, as well as for your nurse managers. So we'll talk a bit about that before we wrap up. Beyond the message, though, your messengers are also very important. So the TLDR here is that if the message only comes from executives, it is likely that it will not land. So your messengers here matter as much as your message. Frontline buy-in happens when messengers at every level are reinforcing the same message in a way that feels relevant and actionable. I think the key here is making sure that everyone has a clearly delineated communication role and that everyone isn't trying to do everything. So it's really about like creating an information pipeline or a communications cascade. So CNOs, you are setting the vision, sharing the message, rolling out new innovations at a high level. And then that responsibility gets trickled down to nurse managers to translate those actions into one-on-one conversations, into day-to-day reinforcement, and even down to peer champions on the unit. As leaders, it's really important that you're not taking on too much as it relates to personal communications, but that you're also delegating to and adequately preparing your nurse managers to have these conversations such that they're better champions. I'd love to hear from 1 to 2 people here. How well do you think your nurse managers are currently equipped to handle these conversations around AI, virtual nursing, etc.? Paula.
Hey, Paula Schmidt, CNO at Freighter. I don't think they are. I think there's a group that is very interested and reads about it and learns about it and is included. And there's some that probably don't know much about it. And they know some of the things we're doing with virtual. But as we talk about AI and how that scales, I don't think there is. And then when the conversations come, a lot of it is a little bit ambiguous. Like these are things we're looking into. So how much do you share and how much don't you? So I can see where the discomfort comes in.
Absolutely. That's a great point, Paula, and thank you for sharing. One of my favorite takeaways from our research that we shared in September is that your managers can be used for good or they can be used for evil. And if you are not equipping them, if they don't have that information, things can actually go really awry and misinformation can spread. So you make a great point there. I'm going to move us on in our last 4 minutes. Jim mentioned this earlier, the importance of an omni-channel approach. So just like with messengers, reinforcement across multiple channels, all of the channels that you see on the left-hand side is critical. That is what is called an omni-channel approach in communications, if you're not familiar. What this does is it ensures that the messages that you are putting out are reaching your nurses in different ways and at different times and through different formats. I think, actually at our cross-system idea labs a couple weeks ago, one of your nurse managers made a great point. And they said, what if someone doesn't read their email? And Deb, you were actually speaking to this earlier as well. How am I supposed to get to them if that's where the communication is going, if that's where these updates are being announced, but they're not opening their emails? Well, then you go to a town hall. What if someone's not attending the town halls? How do we get to that person? They're not attending, they're not reading their emails. We need to find a third thing. And that's where the importance of the omni-channel approach comes in. And of course, on the right-hand side, you can see that some of this differs by tenure. Your early career, your most novice of nurses are really looking for that face-to-face manager time, which is great. That actually can be really empowering if you empower your nurse managers to share similar messages that you are aligned with. Your mid-career folks are really interested in getting that hands-on training to learn more about these technologies. And your veteran RNs, those with the 10 plus years of tenure, generally are reading their emails or their newsletters or intranet announcements. So that's an ideal channel for them. We'll move us along in our last couple of minutes. This is just a recap of what we've discussed today. We'll be sharing these slides in follow-up, so you will have access to that. But before we wrap, just want to share a few deliverables that we have on the docket for the next couple of months, kind of to continue this research. So things that we're planning on sharing, example rollout email templates for new technologies. So this is something you'll be able to download, take away, kind of add in your specs, but something that will already be done for you that is data-driven, kind of hits on those pillars, value props that we talked about. Also example talking points for town halls and huddles, which will include kind of key messages that you can use during those team meetings, really focusing on demystifying these technologies and hitting the points that we've talked about. in the spirit of also trickling things down, offering some scripting for nurse manager conversations to empower them to take those messages and go forth and do, and really equipping them with, if someone feels a concern or a fear about this, here's an example of what you can say, or here's information to cite to maybe help them overcome that fear. And then last but not least, how do you leverage those champions, those folks who have had really good experiences with these technologies, or maybe someone from a specific unit who has a level of comfort with the technology that folks who are newer to it might not? How do you get them on stage or on a Zoom call and talking about these things and spreading the good word? So outlining how to set up that session, and then what kind of questions should you be asking to kind of get that good information out there and circulated from them. So with that, that ends our time today. Thank you all so much for the great discussion and for your attendance. Really excited to share more of this research with you in coming months. But we'll close this out today. And thank you for your time. And I hope you all have a wonderful rest of your week.
Thank you.
Thank you.
Thanks, everyone.